What is sinus lift procedure? Is it possible to avoid sinus lift procedure? What are pterygoid implants? And what are zygomatic implants? So if you want to know answers to all above questions, this is a video for you. Yes, my friend, I Dr. Mayur Khairnar from Precision Dental World, your full mouth implant specialist. So before I tell you what is exactly sinus lift procedure, we should know what exactly the sinuses are. So basically sinuses are nothing but air filled cavities which is available in our cranium, that is in the skull. So coming to the sinus lift, the most important sinus which is there is the maxillary sinus. The upper jaw is called maxillary bone, and the sinus which is present into the maxillary bone is called maxillary sinus. So on this side you can see is the image of a half face that will present the front aspect, and on above me you can see that is the side aspect of any patient. So what you can see over here with the blue color, that is nothing but a maxillary sinus, which is same depicted above me exactly. Now this is called maxillary sinus. So the maxillary sinus is an area which is in the back aspect of the maxillary jawbone. So what you can see now in the black circle is an area which is present in front of maxillary sinus, that is called pre-maxilla. So you can see in the black circle is nothing but a pre-maxilla. You can compare, whenever I am talking, you can compare the above image and the right side image also. So that is the area which is present ahead of the maxillary sinus. One bone is available which is above and on the side aspect of the maxillary sinus, and it is called zygomatic bone. And there is one more bone which is available, but that is available on the back aspect of the sinus, which you can see on above me, but you cannot see in the front image, because that is why I have taken purposely the side image so that you can see the back area bone. That area is called pterygomaxillary junction. So once the back teeth are removed like this, slowly the maxillary sinus expands, and then what happens is there is limited jawbone available. So you can see exactly above me how the maxillary sinus got expanded. So we will see this in this diagram. You will see right above the teeth are there, the teeth are removed, and slowly you can see in the area where the teeth was removed, that was fine, but later on the bone resorption happened and the maxillary sinus expanded, leading to the resorption of the bone. So there is no bone available. Now what happened when the bone is not available? It is not possible to place implants. How? Implants are need to be placed into the jawbone, and when there is jawbone missing, so definitely we need to create some kind of bone by lifting the maxillary sinus and creating a bone graft. Now example you can see in this video, when the maxillary sinus expanded, there is limited or no bone available. In that situation, the old way what used to do was a sinus lift procedure, which is presently avoided in a maximum way by us. So in this procedure, usually what happens, the sinus membrane is lifted slowly. There are two ways by which you can do it. One is by direct way and one is by indirect way. So basically we are showing you a direct way of sinus lift, where a sinus membrane is lifted, the bone graft is pushed into that. We wait for certainly 4 months to 6 months period of time. In meanwhile, we place implants. Again, we wait for 2 months. So total time for implants to heal into the artificially created bone below the sinus membrane is approximately 4 to 6 months. So patient have to wait us for a long period of time. So in that situation, many patients are not comfortable with that. So there is another alternative by which we can avoid sinus lift procedures when we have bone in front of the sinus, in back of the sinus, or above the sinus on the lateral aspect. So that concept is nothing but all on basal cortical. So all on basal cortical is basically a concept where which all the implants are placed into the cortical dense bone, and by which patients can receive immediate loading in 72 hours to maximum within 5 days, all procedures. So if you see this is a diagrammatic representation, so you will be able to assess what exactly I am going to tell you. The maxillary sinus is already expanded in the upper jaw. Now there is bone which you can see as a pink color is nothing but a bone. So bone is present below, very less, but in front of maxillary sinus there is lot of bone. That area is called pre-maxilla. In behind that there is a bone which is called pterygoid. So 99% of the cases can be solved without doing sinus lift surgeries by placing implants into the pterygoid bone and few implants into the pre-maxilla, like this. And over this we can place and attach a multi-unit abutments and give a prosthesis to the patient, which could be a screw retain prosthesis. Okay, so for example you can see the same scenario which I repeated. So this is area where you can see on above me, on left and right hand side, both sides the sinus are very much expanded, but the implants are placed behind the sinus into the pterygoid bone, and in the front of sinus, that is in the maxillary bone. So we need to have bone available in two areas, that is behind the sinus, that is pterygoid area, and in front of sinus, that is premaxilla. Okay, but there are certainly some situations can happen where bone is not available till the extent for placing 4 implants into the premaxilla, that is in the front region of this area. So sometimes sinus may expand like this. If that is happening, we cannot place this implant. It is impossible to place the implant which is marked by an arrow. Okay, so that is a middle implant on both the sides. It is impossible. So in that situation, what we take a support of your zygomatic bone, and the zygomatic bone, what is it? It is a cheekbone, which you can see over here. In this diagram next to me is of green color. It's over here. So that zygomatic bone can be utilized to place an implant, and that's how you can see the implant is placed. Instead of placing over there, the implant is placed on the left hand side, that is zygomatic implant. Okay, suppose it is a situation where the sinus is very expanded. Okay, then definitely only 2 implants is possible in premaxilla. Then we have to take a support of zygomatic implant, and back implant is a pterygoid implant. That's how still it is possible to give a teeth to the patients without doing sinus lift procedures. Okay, now here the maxilla sinus is so much expanded. It has expanded into premaxilla also. So that's why 2 implants. Otherwise, we usually place 4 implants in premaxilla when the bone is available. So you can take an example of this. This is case done recently by us. You will be seeing this case video soon on our next video series. You'll be seeing in detail about the case of this particular X-ray. If you can appreciate this into the CT scans, you will be able to appreciate how the long implant have gone and engaged into the cheekbone. It is not a very invasive procedure because of the present technique. It can be done with the least invasive procedures, and you can see all the anterior implants, that the front implants are placed into this, and the back implants are exactly placed into the pterygoid plate. That is a pterygomaxillary junction, and that's how it is possible to avoid sinus lift procedures, because we are placing implants behind the sinus, in the pterygoid bone, in front of sinus, into the premaxilla, and if not available in premaxilla, then we may use a zygomatic bone. So this is a clear indication of that particular. You can appreciate how this implant, the back implants, that is a sinus, and you can see the implant is getting engaged into the pterygoid plate. You can see. Yeah, so that's how the pterygoid, and see the sinus, it is exactly placed behind the sinus. The arrow is showing you exactly the implant is in the pterygoid junction, and we have not placed implant into the sinus. So that's how exactly you can avoid sinus lift procedures in a full mouth reconstruction. However, it is a case of one single missing tooth, it is not possible. Then we have no options other than doing sinus lift or giving a dental bridge to the patient. But if it is full mouth, definitely sinus lifts can be avoided by placing implants as I have specified in the 3 respective bones. Well, let me take you, if the bone is very minimum, like 2 mm in height, it is impossible to place implants in the premaxilla, that is in the front region of the maxillary bone. It is impossible. In that situation, the pterygoid bone is always available. We place implants in pterygoid and 2 implants into zygoma bone. So that is what we call quad zygoma, and then give multi-unit and then give prosthesis. So if you can see this is a similar case which is done recently, and that is a quad zygoma, and you will be getting a detailed explanation about this case. So if you want to see this case in detail, press the I button above, and you will be able to see how most difficult, challenging 1 mm to 2 mm height bone case was solved with the help of a quad zygoma and pterygoid. So if you see in this, you will be able to see how the implants are placed. You can see the CBCT scans. The 2 implants are engaging into the quad zygoma. Now this is something which is very rare cases, where we have to place quad zygoma. Otherwise, it can be done. 99% of the cases can be solved without placing one single zygoma. It can be placed, but in every case we almost place pterygoid. If you can see the pterygoid implants over here, the back implant, it is placed into the minimum jaw bone with a very great torque. There is absolutely no bone. It is placed into the whatever is the minimum bone available, it is placed into that. And a fantastic torque is achieved, and a patient is now extremely enjoying and happy to receive a fixed teeth. He was rejected by so many doctors for the particular bone available. So it is impossible to do a grafting and something like this. But with the quad zygoma and pterygoid, we solved his case for sure. So you can appreciate in the circle which is blue on the right and left hand side, that is nothing but a zygomatic bone, and one in the yellow is a pterygoid bone. Now you So first you will see zygoma, that was zygoma, and now you will see is the pterygoid bone. Yeah, there's the pterygoid bone now. It's like a section like this, and it is going behind, and it's repeating again. So that's how you will be able to see. So I hope you are now clear how we can avoid sinus lift procedures by placing implants into the front area of the maxilla, that is premaxilla, and implants behind the maxillary jawbone, that is pterygoid bone. And sometimes we may have to place implants into the zygoma, by which a patient can receive immediate loading without any sinus lifting or bone grafting procedure. So if you like this video, do not forget to subscribe our channel, Dr. Mayur Khairnar. On this channel you will find a lot of educational content related to full mouth implants, in which you will get a lot of value. You will be able to see a lot of full mouth implant reconstruction cases. And if you do like this, do not forget to subscribe and share and hit the bell icon so that you will be notified with our subsequent video. On the above side, on this corner, you will be able to see stuff what full mouth implant patient says after the treatment. You will hundreds and 200s of videos of patients sharing their experience about full mouth implants. On below left hand side, you will be able to see a total smile makeover case of a lady who received her teeth in just 3 to 5 days. So stay connected with us. See you soon for our next videos. Till then, Jai Hind, Jai Bharat. Thank you so much.